hormone imbalance,
acne,
weight gain,
you can't cure,
irregular periods,
how do I reverse
infertility, chronic
You're
conditions,
never going to have kids.
no
How do I reverse
cure,
PCOS?
metformin,
weight gain,
insulin
regular
resistance,
periods,
androgen.
no cure, chronic condition.
What does that even mean? Why do they all say different things?
Hi everyone, and welcome to PCOS, a narrative of imbalance, the podcast that delves into the world of polycystic ovarian syndrome, where we go beyond the diagnosis, challenge misconceptions, and share the truth about PCOS. In today's episode, we're tackling the basics because, let's be honest, PCOS can be super confusing with all the medical jargon and symptoms. Joining us today is Katie Bradbury, a qualified nurse and women's health practitioner, who's ready to answer our questions and make PCOS easy to understand. Plus, we have Liv, a fellow student living with PCOS, here to share her experiences as well. So let's just jump straight in. I have PCOS, Liv, I know you have it as well. And Katie, you know all about it.
And I have it.
And you have
Yes,
it, okay.
brilliant.
Perfect. So obviously the podcast is about PCOS, but I want to actually understand what PCOS is. So I'm going to read you out the definition, but that definition just goes straight over my head. Polycystic ovarian syndrome is a common hormonal disorder affecting reproductive age women, characterised by irregular periods, excess androgen levels, and small follicles on the ovaries. But what does that actually mean?
Yes, very, very good question, because it's a bit of a meaningless definition unless you are up on your biology, right? So I guess for me, one of the main things around PCOS is how that individual is experiencing it. And that can be very different across the lifespan. So for a lot of people, they only realise that they have PCOS when they are trying to get pregnant, and it's a barrier. And then it feels like a bit of a crisis, actually. So that's a big deal to find out then at the point that you're trying to have a baby. But increasingly, as awareness gets better around PCOS, people are getting diagnosed earlier. And when people are younger and trying not to have a baby, then the impact of PCOS might be more symptomatic. And so that could look like, yes, the absence of periods or irregular periods, but it can also look like things such as acne. It can look like tiredness. We're laughing.
Definitely the acne.
Fatigue is like a much less well-known symptom, but a really common one. It can mean like mood changes as well, and it can also mean hirsutism, which is essentially like a male patterned hair growth for some people as well. So it really just depends on the individual, the type of PCOS, and also then how those symptoms might impact that person's life.
Yeah, so like you just mentioned, I believe there's 4 different types of PCOS.
Yes.
Could you explain them a little bit for us?
Yes. So again, the most common type of PCOS and the one that is really dominated in all of the NHS definitions, and the one that's really assumed is insulin resistant PCOS. And that, we think that's around 60 to 70% of cases, so a significant number, but definitely nowhere near all. And insulin resistant PCOS is defined by something called insulin resistance, which perhaps we can go into a little bit later. But the other 3 types are post-pill PCOS. So some people have PCOS temporarily after being on the hormonal contraceptive for a long time. And then the other 2 types are androgen based PCOS and inflammatory PCOS. And they all have different underlying drivers and different things, different symptomologies a lot of the time as well. And it can often lead to misdiagnosis as well. So I'd say the insulin resistant PCOS is the one that is most widely known and kind of taken as gospel within the NHS, and the others are lesser known and perhaps not taken as seriously.
I didn't know that when I first got diagnosed that there's 4 types. I can see Liv going.
I was like, there's 4 types of PCOS. I didn't even know this now. That's so crazy.
Well, now you do know.
Yeah, that's brilliant.
Then I suppose you kind of have to figure out which one you are. But yeah.
Yes, exactly.
Yeah. Yeah, definitely.
Yeah.
So this podcast is mainly about like the misconceptions of PCOS and sort of like putting them to rights. So what do you think the biggest misconception is?
There are two that I really grapple with, I think, and those two are one is that you can't get pregnant if you've got PCOS. That's just not true. Obviously, infertility can happen across a range of different circumstances, but many people who have PCOS go on to have happy, healthy babies, right? So that's one of the biggest things. And the other one perhaps isn't a myth as such, but it's something that people are told all the time, and it's on the NHS website and everything else, and it's just go away and lose weight and that will solve your issues. And there's very little guidance on like the whys and the hows of how to do that. But even on the NHS, it's like, just go away and lose weight, have a healthy balanced diet, and all your problems will be solved. And that really I find very grating.
No, it's really not that easy.
And I remember actually when I first was diagnosed, they were like, if you just stay the same weight, stay exactly the same, and actually how harmful that is for like especially young women then to hear that as well, like those aspects of it that come with it, and also like with obviously the influctuations, then that really has like a overall effect on your like how you see yourself. So
it's really not that easy, and you can keep going back to like the doctors and they're like, no, just lose weight. I'm like, but I'm trying. It's not happening. I think that definitely is one of the biggest misconceptions, and that's one of the ones I want to talk about. So like, just you can't lose weight with PCOS. I think that's a very big misconception, and I don't want that to be true. Like, I know you can, but I think it is really difficult. So why is it so difficult for people to lose weight with PCOS?
Yeah, I mean, it's again, we need to distinguish a little bit between types here, and people who are more presenting with the insulin resistant PCOS, that is the classic gain weight very easily and find it very difficult to lose weight. But also it can be a contributing factor in inflammatory PCOS as well. And the reason it can be so hard, it's absolutely not impossible, but it can be very hard, is because it's bidirectional, and so it turns into a bit of a cycle. So insulin resistance causes PCOS, and PCOS causes insulin resistance. Okay, and it's the same with the inflammatory side as well. So inflammation can be a contributing factor to PCOS, and PCOS can cause inflammation. So it's very, you can quickly see in those stark terms how it's difficult to break out of that cycle. It's not impossible. Exactly. But it is much harder. And so the usual approaches of like just eat a healthy balanced diet might not be sufficient to help someone with PCOS break out of those cycles. Yeah,
definitely. Would you say that like, if you wanted to feel better, is weight loss even the right thing to focus on to begin with?
Yeah, I mean, it's a very big question, and it's a have we got all day kind of question, I think, that one. And it's because I think what you were saying is around, there's so much there around our sense of self-worth, and for women and people who are socialised as women, you can't get away from that, right? You can't get away from the awareness of being under the male gaze, and very much an awareness of our body shape and our value being held against that. So in essence, I don't think it's helpful to just go away and be told to lose weight, because I think it shifts the blame onto that individual person, when what we've just found out is that it is really hard. It's not straightforward. So it's almost like, oh, well, it's your own fault. Like, you know, if you're overweight, what do you expect? You know, that's certainly how I felt.
That's how I felt.
Yeah. And this notion that you had of just stay the same way. You know,
for me, it's like I've always been smaller, but I would have fluctuations of like I would gain a lot of weight and then lose a lot of weight and stuff like that. And I went in there being sort of at quite a medium weight, and they were like, stay the same. You need to keep at this or keep what you're doing. And it was so unhealthy afterwards. It definitely caused a lot to go on into my brain and how I saw myself, especially having that diagnosis and then being told, you now have to deal with that. You now have to deal with this perception of your body and your weight. I think it's extremely harmful sometimes for when it's such a vulnerable thing to go there already and find out these things, and then you get told you have to stay this or eat this, or exactly what you said with the male gaze already has such a impact. Just being a woman in this day and age already has so many hardships.
It's a lot more of like a mental battle, even, and also a physical battle, but it's really mentally draining.
Absolutely.
Like, I think anyone that knows me can like attest to that. Like, yeah.
And you know, a lot of the publications on this make it sound so simple, right? Just lose 5% of your body weight, and even that can make a difference. That's what a lot of the websites that's on the NHS say, and it's just not that simple a lot of the time. And so my kind of, I guess, personal and political belief is that no, it's not helpful to focus on just the weight, and what is more helpful is to focus on actually what are the underlying drivers for my PCOS, and doing a bit of the digging, which is perfectly possible. It's not that hard, and then work on those. So if the focus then becomes around, okay, well, let's focus on insulin resistance rather than I must lose weight, then it just shifts the focus a little bit, and I think makes it a bit less self-derogatory.
Yeah, definitely. Well, we'll move away from like losing weight. That is a very big discussion. We could sit here all day talking about it, but that will be in like a different episode. I also want to talk about another big misconception is that like PCOS can't be cured. I know that there isn't a cure for it, but more of like you're supposed to manage it instead of like cure it. Can you like explain a little bit more about that? Yes.
So PCOS is it's a syndrome. It's a syndrome, right? And technically speaking, if you have PCOS, you've got PCOS for life, right? But if you look at the things that define PCOS, which are in medical terms, there are three criteria. One of those is having an irregular or missing menstrual cycle. One of them is having excess androgens or excess testosterone, either symptomatically or confirmed by bloods. And the other one is having the appearance of cysts on the ovaries. Even the name PCOS is completely misleading, and there's a big push to actually rename PCOS because they're not even, the cysts that you have on your ovaries aren't even actual cysts, they're follicles, they're underdeveloped follicles.
That's even in the definition, but
Right. Yes, this is
first hearing that. I'm thinking there's cysts, there's cysts there that I don't know about because like that's how they describe it.
Because I remember, like we can talk more about this, but the way you get diagnosed is there's like 3 points.
Yes.
So like it's either you have a blood test or you have like an ultrasound. So like I've never had an ultrasound, but I've had blood tests. I don't actually know if there's any follicles on my ovaries.
Yeah.
And then it's on there's other points where it's like irregular periods, and then I forgot when the last one. It's either like if you've got like acne or hair loss. Am I correct?
Yeah. So those are symptoms of high testosterone. Yeah, exactly. So if we think about those being the main clinical presentations of PCOS, then absolutely someone with those symptoms present, with those 3 things present in their life, can go through and manage those to a point that they're not there anymore. And I'm one of those. I wouldn't be clinically diagnosed with PCOS anymore, but I did have it, and it stopped me from getting pregnant for a very long time. So it's it can be there but not there, because it is a condition that is heavily influenced by lifestyle, and so we can use that in our favour.
Lots of people with PCOS just get put on the pill. You don't get listened to begin with. You can say, I've got an irregular period. That literally happened to me for maybe like 3 years, and like it wasn't until I was like, no, there's definitely something wrong. Please listen to me. Like why do you think it is people, that's just the instant answer, just take the pill and you'll be fine?
I mean, look, we live in a medical system that is under-resourced ultimately, and medics are limited in what they can actually offer people.
Yeah.
So in an ideal world, there would be this whole system of support around people who have PCOS to navigate it. But the reality is, where there's a simple possible solution, like the pill, that's what people are given. The limitations of that are that one, the pill can also cause PCOS.
It causes worse symptoms.
So two, the pill doesn't. So one of the reasons the pill is given as a solution is because if you have a missing menstrual cycle for 6 months plus, then it can increase your risk of things like endometrial cancer, right? So there's a good reason medically to want to have a menstrual cycle. And the pill, in a way, does that. But again, even that's quite misleading because the pill doesn't actually give you a menstrual cycle. It shuts down your menstrual cycle, but it does induce a bleed. So the induction of the bleed is what causes is what protects your uterus, your endometrium from proliferative cancer, essentially. So it's, there are good reasons why they might be. I think it's well intended, but it just kind of misses the mark a lot of the time. And of course, then if we consider the fact that a lot of people who have PCOS or find out when a lot of people find out they have PCOS when they're trying to get pregnant, going on the contraceptive pill is not what they want to be told, So, it's a complex condition, and I think medically it's oversimplified, and the treatment approaches are oversimplified.
Well, I mean, I've never been explained how the pill does and why it did to me, so that makes so much more sense. Yeah,
mine caused me to bleed for a year straight, but from just how much it impacted, and then I went on. So I waited 2.5 years because of COVID and everything to sort of get that diagnosis. And then it wasn't until I went on the pill afterwards, they also found I had endometriosis. So then it's interesting how things then show up through taking those contraceptions. Yeah.
Another misconception I'll talk about is a lot, and you'll see this online, like people tell you just don't eat sugar, full stop, no. And I tried that and it's really difficult. I have very much like a sweet tooth and I want to do that, and I think to cut it out straight away is very, very difficult.
Yes.
Why do you think there's such a big misconception about that? I know that it's related to like insulin resistance, but I'm not 100% sure what that actually means.
Yes. So insulin resistance is it happens. So when we eat well, it's not even a matter of when we eat sugar, it's when glucose enters the bloodstream. And glucose can enter the bloodstream from any carbohydrate turns into glucose. So we're not just talking about sugar here. All carbohydrates, because the purpose of eating carbohydrates is for energy, and glucose is the brain's primary source of energy, right? And so all carbohydrates break down into glucose in the bloodstream. So they have an important job to do because they give us energy. And when we have glucose levels in our bloodstream, our pancreas produces a hormone called insulin to just make sure that those levels don't get too high, and just take that glucose where it needs to go in order to be utilised. When we have insulin resistance, it means that our bodies are less sensitive to that insulin. And so the pancreas goes on overdrive and starts producing more and more and more insulin to try and deal with the glucose in the bloodstream and get it to the right place. And when we get to that point of this really overproduction of insulin, then the effect of that is that it tells the ovaries to it kind of shuts the ovaries down a bit, essentially, and the ovaries, the communication from the ovaries is to produce more testosterone. So that's the mechanism. So you could deduce from that okay, well, if I have insulin resistance, I must never touch sugar, and sugar is evil. And certainly sugar intake and overall carbohydrate intake is a clinical consideration in the management of PCOS. However, we are not lab rats. We are people. and we have lives and likes and dislikes and social lives and stressors, and food is not just, we don't only eat food for energy or for health. We eat food socially, we eat food for pleasure, we eat food to drown our emotions sometimes, and all of those are just a part of the human condition. And so to then try and pretend that we do just exist in this silo where, you know, if only we just had enough motivation that we could cut all sugar out, and it everything, all avenues here then turn to shame, don't they? Ultimately it's blaming yourself and thinking, this is my own fault, there's something wrong with me, and it's because of what I'm doing that is causing this. And that is just the most unhelpful possible relationship that we could be in with our bodies. So there's no easy way through it. Yes, you know, we can't deny that sugar is a factor, and carbohydrates are a factor in PCOS and insulin resistance management specifically. And we need to find a way through that is actually going to work for that individual human and all of their other needs.
Yeah, it's really difficult because you can't just follow one simple rule. Like, I've said this to so many people, like, I want an answer, but there isn't a simple answer. I said that to you the first time we met. I was like, I just want an answer. But it's just not that simple, and it's not the same answer for everyone else. That's why it's so confusing. So today we've talked a lot about insulin resistance. That is sort of like, I think, the big word of this podcast so far. What is insulin resistance? If you could describe it in like a really simple way, how would you describe it?
Yeah, I would say that insulin resistance is essentially an imbalance in the way that our bodies digest glucose and metabolize glucose. So and it can be a big driver in PCOS. I guess the thing that I want to just add to that is, if you think you might have insulin resistance, there are three things that you can focus on that shift away from just stop eating sugar. And those three things are: eat enough protein, eat enough protein with every meal, eat more fibre, so increase your range of plant foods and plant diversity, and build some muscle.
Okay.
Yeah.
Well, we've come to the end of the podcast, and I've just got a couple more questions left, but I think we've had a very important discussion. I've definitely sat here and feel like I know lots more about PCOS. And
absolutely, like I feel actually like I know so much more now. It's really been really helpful.
So thank you so much, Katie, and thank you, Liv, for like sharing your experiences as well. It's been really, really helpful.
Thank you.
The last like couple of questions I have is just like, so if someone's listened to this and they think that maybe they do have PCOS, what is like the first thing that they should do, whether that's go to the doctor or just like anything like that?
Yeah, I mean, I think the doctor's office is the first port of call, really. And I guess it's knowing how to advocate for yourself is the key, because there's a good chance, this isn't a slant on doctors, it's just a slant really on the resources in the NHS. There's a good chance that you're going to be maybe turned away or put on a mega wait list, or not being taken seriously. And so I think if you listen to podcasts like this and really generate an awareness of, okay, like this is why I think I have PCOS. These are my symptoms. This is what I would like to know. So if you have some clarity as to what you actually want to get as well, maybe I would always recommend doing blood tests as a starting point, because getting some, not just hormone blood tests, but getting some wider blood tests done as well, around like your blood sugars, for example, because that's going to help you understand if there's insulin resistance, and like your liver, the condition of your liver can help to understand whether the sex hormone binding globulin might be high or low. So there's more to it than just the hormones. So I think if you can get a really good comprehensive panel, and like, you know, iron and vitamin D crucially, so lots, and these are all blood tests that are available on the NHS, but you need to
You need to ask for
You
them.
need to ask for
This
them.
is what I've realised. You have to go and be like, I want these blood tests. That's
Yes.
what my mum says to me all the time. She's
Yeah.
like, you need to tell them what blood tests you want. And yeah.
If I go to doctors, I go with a list.
Yeah.
And I
Notes
sit there
app
and
full.
I tick it off when I get, I've asked about this one and I've asked about this one and I've asked about this one. So
Yeah, absolutely. So yes, I would say doctor's office first port of call, but know how to advocate for yourself, and don't be swayed for what you might be told, because it can be a bit of an emotional roller coaster.
Well, that sort of leads me on to my next question of like, if someone is diagnosed and they're feeling really overwhelmed, what would you say to them? Just kind of start to get some answers and then, Yeah, I think getting a diagnosis like PCOS can feel like such a mountain, and I think we've probably unpicked why here, because it's not straightforward, but it's a mountain. Like such a cliche. Every mountain like needs a first step, right? And so if you think, oh yeah, well I'm stepping onto this massive mountain, fine. Like there may be a mountain to climb, but like we can climb mountains, right? We are resilient, and there may be a journey ahead, but we need to start somewhere. So just understand that it's not that there are things that you can do. There is plenty of support out there, and it's not the end of the world. Like there is so much that can be done. Oh, I love that. That
Yeah,
is
that
so
makes me
much
feel
more encouraging.
emotional, honestly. Yeah.
Yeah. No, I think that's like the perfect way to end it. And then my last question is, if you could erase like one misconception, one myth forever, what would it be?
I think for me it would be the thing that I spoke about at the start, which isn't a myth so much, but it's this idea that you should if you get a diagnosis with PCOS, you just go away and lose weight and all will be well, because it's not that simple. And it just harbours such a sense of self-blame. So if that's what you've been told, then know that's that if you've been struggling to lose weight, like we see you, it's not that simple. And again, it doesn't mean it's impossible, but with the right approach and the right support, then you can get there. Not that you can get there as though weight loss should be the ultimate goal, but you can get there as in managing the PCOS.
Yeah, definitely.
Yeah.
I think that's the best one. If I could never have heard that, I think it would have been a lot better.
Helped so much.
Yeah, definitely. Well, thank you guys for coming on the podcast. You've been really, really helpful. Thank you for listening to the podcast. We hope you've learned more about PCOS and feel a little bit less confused. If you want to keep exploring more about PCOS, don't forget to check out our other episodes, where we'll dive deeper into symptoms, nutrition, management, and so much more. And be sure to follow us on social media at Narrative of Imbalance Pod for all the latest updates. And just remember, you're not alone in this journey. We're here to support you every step of the way. See you next episode.